Good day, I am E.I.N.C. So today I'm going to demonstrate E.I.N.C or the Essential Intrapartum Newborn Care. So E.I.N.C is the standard care for births recommended by the DOH for medical practitioners. So through this, there is a potential to decrease the deaths at least half. Good day, ma'am. I am E.I.N.C. your midwife student. I am here to help. I am here to help and guide you delivering your baby. So, how are you today, ma'am? Are you fine? Are you okay? Okay, ma'am. Ma'am, your cervix is not yet fully dilated. It is only 8 centimeter. We just have to wait. And please, ma'am, don't eat or drink anything before the delivery. So, in preparation for the delivery, check the room temperature at least 25 to 28 degrees Celsius. Then, close the windows if needed. And then, check the position of the mother. Ma'am, are you comfortable of your position? Okay, ma'am. The position of the mother is semi-upright. And then, remove all the jewelries. And then check the equipments needed. So we have here vitamin K, and then hepatitis B, and also the BCG vaccines, and then eye ointment, the oxytocin injections, a kidney besan, and also 2 sterile gloves, the cord clamps, scissors, also a bonnet, and a clean, dry linen. And then do a proper hand washing. At the time of the delivery, encourage the mother to push. Ma'am, inhale, exhale, then push. Inhale, exhale, then push. 1, 2, 3, push. And then grab a dry clean linen and place it to the front of the mother in the abdomen in preparation for drying of the baby, thoroughly drying of the baby. Apply perineal support and control. 1, 2, 3, push. 1, 2, 3, push. 1, 2, 3, push. 1, 2, 3, push. Baby boy out, 2:30 p.m. Thoroughly dry the baby. Wipe the eye, the face, the head, the trunk, the arms, the leg, and then remove the wet linen. And place the baby into the mother's abdomen for skin-to-skin contact. Then cover the baby with dry and clean linen. Also use a bonnet. This is to promote mother and child bond for breastfeeding success and for lymphoid tissue stimulation, and then exposure to maternal flora, and then protection from hypoglycemia, and for thermal regulation. Palpate the mother's abdomen in preparation for giving oxytocin injections (IM) within 1 minute after the baby's birth. This is to prevent hemorrhage or excessive bleeding after vaginal birth. So in cord care, remove the first set of gloves. Discard. And then palpate the umbilical cord. And then clamp the umbilical cord 2 centimeters from the umbilical base. Melt the umbilical cord away from the baby gently, and then clamp at 5 centimeters from umbilical base. And then cut the umbilical cord just near at the first cord clamp, and then wrap to the scissor and then set aside. Wait for strong uterine contraction. Massage the uterus until it's firm, until the delivery of placenta is complete. Inspect the lower vagina and perineum for any laceration, and then the placenta will come out. Put it to the container, and then place the placenta to the container. Examine the placenta for any abnormalities and completeness. So the placenta is complete, then set aside. Clean the mother by flushing the perineum and apply perineal pad, napkin, or cloth. Check also the baby's color and breathing. So the baby is okay. Then check the mother's comfort and if the uterus is contracted. So are you fine, ma'am? Okay, ma'am. And then dispose the placenta in a leak-proof container or plastic bag. And then set aside or dispose. Decontaminate the instrument before cleaning. Soak in 0.5% chlorine, and then decontaminate the second pair of gloves before disposal at least 10 minutes. Then advise the mother to maintain skin-to-skin contact with her baby. So the baby should be in prone position, nakakulob siya on the mother's chest between the breasts. And then with head turned in the one side. Then advise the mother to observe for breastfeeding cues such as mouth opening, lip licking and sucking, bringing hands to mouth, moving head as if looking for the mother's nipple, and then cleansing of face and fingers over the tummy, bending of arms and legs, and fastness. Then support the mother, instruct her on positioning and attachment the baby, and wait for full breastfeeding to be completed. So ma'am, if you needed something, don't hesitate to call me or to make me assess you. And then ma'am, you should observe the baby's attitude, just like what I've said. After a complete breastfeed, administer to the baby eye ointment to protect the baby from an unknown gonorrhea infection in the mother's body. So thoroughly physical examination to the baby. Observe if there is abnormalities. Nothing. And then administer to the baby a vitamin K 0.5 ml IM to the vastus lateralis. This is to prevent the low levels of vitamin K and vitamin K deficiency bleeding. And again, administer to the baby hepatitis B vaccine to prevent the baby as early as possible from any exposure to the hepatitis B virus. 0.5 ml Lactobacillus right, and then it is IM. Lastly, administer BCG vaccine to the baby to protect the baby from serious form of tuberculosis like TB meningitis and Malayari TB. It is intradermal arm. Advise optimal delayed bathing of the baby after 6 hours to avoid complications like hypothermia and infections and brain hemorrhage. Advise breastfeeding per demand. So in the first hour, check the baby's color and breathing, check the mother's vital signs, and massage the uterus every 15 hours. In the second hour, check the mother-baby diet for 30 minutes to 1 hour. And then most importantly, complete all the records. And that's all. Thank you.